Palumbo here with RxMuscle.com, and I'm having an early Christmas. And what do I mean by that? Well, not many people can buy me gifts or send me gifts that I'm actually like, wow, that's awesome, like I was when I was a kid. But Titan Medical Centers at TitanMedicalCenter.com sent me my package. Now, I got this a while ago, so I have not had a chance to really talk to you about Titan Medical because of the fact that we moved, as you know. And so this was in my suitcase, and I just opened it up, and I actually started looking through this. And I've been using some of this stuff, so that's why it's open, or I would have opened it in front of you. But the bottom line is that Titan Medical is a rejuvenation clinic that specializes in hormone replacement, injectable vitamins, from amino acids to antioxidants, polyphenolics, all the stuff that's right up my alley. And I sat down, I talked with them. I found that, and I felt that their vision for health, wellness, and keeping people healthy rather than treating symptoms was exactly where I wanted to be. I also love the fact that all the people who go there don't have to go to Tampa and actually go to the clinic and visit there. They can go online and do a Skype consult with the doctor, which makes it very convenient for people who live out of state, like in California or Colorado. I have clients all over the place, and people who are interested in getting hormone replacement who just don't want to or don't have the time to go down to Florida. So this is a perfect clinic and a perfect setup. You call them up, you give them, say, Dave Palumbo referred me, so you get your discount, and that's important. We all want the discount. They'll send you for blood work, and then when the blood work comes back, they'll be able to read it for you and tell you how you're doing, and then they can prescribe whatever you're looking for, whether it be testosterone replacement. If you're a woman, you want to get creams, testosterone cream, or you want to get some Anavar, or if you want to go on growth hormone releasing peptides, or even IGF-1 they even have now. Plus they have the growth hormone releasing peptides. And one of the most exciting things that I haven't seen ever from anywhere was injectable vitamins. Specifically, one of the best, greatest antioxidants in the body that our body produces is called glutathione reductase. And that really, inhibits more free radicals in the body than anything else out there. The problem is it's not orally absorbable, but when you inject the stuff, it's super absorbable. So I basically got this huge bag of stuff from them, and I'm going to go through it and see what's, because I've only pulled a few things out, so I don't really even know what's in here yet. So let's look. The first thing I see is HCG, human chorionic gonadotropin, obviously, which is important because I'm still trying to have another child. We haven't really started the process yet, so to speak, because Logan is only 10 months old and we just moved here, but we will start again, so I might have to kick some of this stuff in. So this is good. We'll throw this on the side. Excellent. They actually sent me 2 bags of it. So this is another human HCG, human chorionic gonadotropin. I got needles here. We always can use those. I got a bottle of anastrozole, Arimidex. This is an aromatase inhibitor. It inhibits the conversion of testosterone into estrogen. Now, because I'm not on a full-blown cycle, I wouldn't want to take a lot of this. So I'm only going to take a 0.5 milligram twice a week because that's more than enough. I might not even need that much. And the best way to find out if you need it is go for blood work and check your estrogen levels. But this is a great aromatase inhibitor. We'll throw it on the side. Now we have, let's see what this is. You know what? As you get older, you can see far, you can't see close anymore. All right. This is called their Tighten Up formula. This is their injectable fat burner. It's in a bottle, but it's actually a vial inside of here. And I'm going to read you what's in it because it's got some great ingredients. It's got methionine, inositol, choline, thiamine, which is a B vitamin, riboflavin, also B vitamin, niacin, also B vitamin, pyridoxine, another vitamin B6, that is, cyanocobalamin, which is, or they actually have methylcobalamin, which is vitamin B12. Obviously, we all know it's better absorbed injectable. And it's got L-carnitine in here. So it's got injectable L-carnitine, and they put a little lidocaine in here so it doesn't hurt when it goes in. This stuff is dynamite if you're trying to burn fat. I recommend it. Once again, L-carnitine is another one of those things that it's a good fat burner, a good fat mobilizer, because it helps transport long-chain fats into the mitochondria to be burned for energy. The problem is when you orally take it, it doesn't get absorbed that well. When you inject it into yourself, it always gets absorbed. A much better version. So this is called their Tighten Up formula. So if you're looking to burn some fat, ask for this. Okay, let's see what else we got here. This is the super. This is the great pre-workout. This is we take a lot of pre-workouts. I know you guys out there love to take pre-workouts to get the pump, better endurance. This is injected right into the muscle. This is called the Super Titan formula. It contains glutamine, ornithine, arginine for obviously nitric oxide release, lysine, citrulline, also another great nitric oxide releaser, and a little lidocaine so it doesn't hurt going in. Once again, take this right before the gym. Sometimes I take it when I wake up in the morning and I'm in the car, I'm like lightheaded because I'm like so pumped and there's so much blood in the muscles. But this is great pre-workout. I might take some of this before I go to the gym. Let's see what else we got here. Then we got this. I think this is my favorite. Now this is more tighten up. This is tighten up again. Hold on. I'm getting duplicates. This is more HCG. More. This is good stuff. This is testosterone and anthate. Not only is it 200 milligrams, it's 210 milligrams because they want to be just a little bit better than everyone else. 210 milligrams per cc. This is a 5 ml vial, and actually, is it 5 ml or 10? It's a 10 ml vial, excuse me. So this is a 10 cc bottle of 210 milligram test and anthate. So you got 10 shots out of here. This will last you 10 weeks if you're taking 210 milligrams a week. Okay, that's great. Let's see what else we got here. I got a bottle of Ultra Test. Now this is a different formula. This is 200 milligrams per ml, but it's got a 90% test-cypionate, 10% test-propionate blend. Now I told them I'm very allergic to test-propionate, at least the ones I take in bottles. They told me and assured me this test-propionate would not hurt me. I have not used it yet because obviously I'm on the baby making protocol right now. We can't use steroids or any kind of testosterone replacement, but Johnny's eyeing this bottle up. I might have to have him try it out. This is my prescription, so I can't do that. Once again, this is a 5 ml bottle, however. This is their Ultra Test, so you might want to ask for this if you like propionate. And we have, what else? This is another Tighten Up bottle. Okay, this is the other Tighten Up bottle. Oh no, this is the antioxidant formula. This is the glutathione. This is also known as, what do they call it on this site? Maybe Johnny can look it up. It's got a name. It's called like some kind of, look it up, Johnny. It's the antioxidant formula. And then I have one more, actually, I have a couple things I left at home. One more surprise thing. You see this unlabeled? It says Dave Palumbo with a little smiley face in there. This is the new fat burning cream. They told me they would do it, but I actually suggested that they do this a couple months ago. It's a very high potency aminophylline cream. We used to use this back in the 90s, to burn fat in like trouble areas. It works. The stuff definitely works. You put it on trouble areas before you go tan or before you go to bed or even do cardio. I know some of the extreme people would wrap their bodies with saran wrap with this. I don't think it's necessary, but it can't hurt. This stuff does work. Don't overdo it though, because the aminophylline will, can make you a little shaky if you do too much of it. It will become systematized if you overdo it. This is the prototype. I think by now on the website they actually have the real stuff too. So you guys might want to try this if you have trouble areas. Luckily, I have no body fat in my body. I'll have to lend it to someone who might want it. Maybe I'll give it to Mel Chansey. He probably has his own though, because he goes to Titan Medical as well. The bottom line is that if you want a convenient clinic with doctors that are progressive thinking and they're not going to be afraid to prescribe hormone replacement to you or give you injectable vitamins, cutting edge type stuff, contact TitanMedicalCenter.com. When you call the number there, tell them that Dave Palumbo sent you and you will get a discount. I promise you that. Once again, there's not many clinics like this around. You don't have to go there. You can do a Skype session with the doctor online. And don't worry, if you're on hormone replacement now and your levels are higher and you're worried about going for blood work, explain to them, the doctors, hey, I'm on hormone replacement now. I want to switch to your clinic. And guess what? They're going to understand. They're not going to make you go off the stuff and get your levels down to zero. Continuing treatment is an option here. It's a very realistic thing. I know a lot of guys are on hormone replacement already, and it's just a pain in the ass to get it. This is an easy way to get it. They mail it to you every month. You call your order in, no problems. Check it out, TitanMedicalCenter.com. Dave Palumbo endorsed.